You're watching Demetria Kaladinos and Dan Miller. Channel 4 News. Coverage you can count on.
Tonight, an amazing story that reads like a medical miracle. Matt Higgins was just 4 years old when he was diagnosed with Stevens-Johnson syndrome, a severe infection that took away his sight and could have killed him. For the last 13 years, Matt has been legally blind. But yesterday, he defied the odds once again. And health reporter Terry Merriman was there to witness it all. Terry?
Demetria, Matt Higgins has spent 13 years of his life with scarred corneas, able to see only hints of light and image. Dr. Ming Wang has spent 15 years of his life researching an unborn child's ability to heal without scarring. Well, yesterday, two people who had been working toward an important goal realized miracles do happen.
A person who influenced my life in my late teens.
Matt Higgins and Dr. Ming Wang have waited 6 years for this moment.
I think this is the most amazing thing, that all the research or the work, eventually you'll find that actually can really make a big difference in patient's life.
You know, I've never seen his cornea this clear.
Matt was too young for reconstructive surgery on his scarred corneas when he first came to see Dr. Wang, but last week the time was right for the final step, helping Matt's eyes heal themselves. Dr. Wang performed corneal stem cell transplants using tissue from an adult donor and an amniotic membrane transplant using tissue donated from a newborn.
And I call this type of technique tapping fountain of youth. You kind of take advantage of the youthful healing ability and use a piece of tissue, in this case amniotic membrane, which is always discarded after cesarean section, then transplant back to adult eye and heal the eye.
An unborn child has scarless fetal healing ability. This membrane converts the same healing ability to Matt's eyes.
You know, between science research and our faith and moral principles, there are opportunities like this you can, you know, satisfy both.
Don't have to be afraid.
Now, Matt must learn to see again, learning to feel light on his eyes. He's making great progress.
People wonder if that miracles ever happen, and they have. They do. For so long, he's been beside me, afraid to branch out on his own almost. And now that he can see, he'll probably fly the coop.
Well, maybe he's not ready for flying the coop, but Matt does want to get his learner's permit to drive as soon as the doctor says it's okay. Dr. Wang is one of only a few doctors in the world performing this surgery. He's an associate research professor of biomedical engineering at Vanderbilt University. For more information, check out our website, WSMV.com. Back to you.
Amazing story. Dr. Wang has used the same technology to develop an amniotic membrane contact lens. It can be transplanted shortly after cornea trauma to prevent scarring. Dr. Wang is a staff surgeon at St. Thomas Hospital.